Joseph, HR have been asking about me.
Mark just said he wanted to know if I knew whether he had ever been called Wilson.
What did you say?
I just played dumb.
Because you see, I never gave HR my married name. I just told them that I was Faye Morton because, well, after James and I fell out, I ditched the name.
Understandable.
So, what should I do?
I just think you should tell them. This is probably just a friend who's trying to keep in touch with you.
Yes. You're right. I'll call them.
Faye?
Yes?
If it's anything to do with me and Jack, then do what you feel you have to.
I won't say anything. I promise. Oh, thanks.
Hi.
Someone's trying to get hold of Faye, but they're asking after her as Faye Wilson. Her married name.
Can you think it's to do with us?
I don't know, but it might be. She's on the phone to HR as we speak.
Don't panic, Joseph. Don't say anything to anyone.
Jack, I've got a bit of a problem. Mr. Gilzine's ultrasound didn't show up at tumour.
I'm sorry, Diane. I'm really busy at the moment.
I just need you to help me with a couple of patients just whilst I sort out the tumour.
Well, I'd love to, but I can't.
Don't get me to go to Mr. Clifford and ask him to make you.
Make me. Yeah, right. Making inquiries about us, then we need to have the same story.
There is no story. Can't change anything.
What will your father say?
I dread to think.
This has probably got nothing to do with this. We're panicking for nothing.
I need to find Faye and see what HR says.
Joseph, what do you know about a patient, Ali Jarvis?
She's my idiopathic cardiomyopathy, waiting for a transplant.
Well, I knew her grandfather, William, and he was professor of astronomy at the university. Her father, Miles, wrote me this letter asking me if there's anything I could do.
Ali's on an ECMO, her third week. Side effects are kicking in. Chances are she won't be leaving the hospital.
So, that's it?
Unless there is a donor. Really, there's nothing else.
Right, then, well, speak to him. Tell him we're doing all we can.
Bay 3.
I thought I'd read somewhere.
Have you spoken with HR?
Yes.
What did they want?
It was my husband trying to get hold of me.
What's happening with him?
It's all a bit difficult. I didn't want him to find me until I'd sorted a few things out, so if they start calling again, can you just say I'm not here?
Of course, we will.
Thank you.
The Oslo heart.
Yes, what about it?
Well, I read about it somewhere. What do you know about it?
It's a prototype assist device. It sits outside the body and supplements the malfunctioning heart of the recipient.
You don't think that's something you should consider for your patient, Sally?
Ali?
Yeah, her.
No, it's not right. It's only a prototype. We can't risk it.
Well, if she's going to die, what's the risk?
But, yes, I am aware of what it is.
So why weren't we offered it?
We felt that Ali was too weak. If we'd have thought it was worth a try, we would have given it to you as an option.
I'm sorry, this is my fault. The Oslo heart only occurred to me because of its recent sanctioning in Germany.
I read that same report.
For research purposes only, and even with informed consent, it is only being trialed on
Can you make
specific
sure that
cases.
Jack gets these, please, when she's finished? They're her patients. They're waiting to be seen.
Sure. Rough day?
Does it show?
Yeah, to be honest.
But surely there's no harm in reconsidering.
I really don't think that now is the time
But if
to
they've sanctioned tests on humans, then what's the problem? As far as I understand it, if there isn't a donor, then Ali's prognosis is not good. Surely anything's worth a try.
You quite understand the circumstances.
Then maybe you should explain them to us.
I don't think that it will work. And it will involve unnecessary surgery for Ali.
If the Oslo heart is meant to save people like Ali, then why not test it on her? If it fails, nothing's lost. But if it works...
Joseph?
She's putting the cat among the pigeons, I'll give you that. She certainly knows how to play the game. Well, she knows how to play men.
What's happening?
Snail is using her feminine charms to put her hooks into Lord Burnham.
I don't think Joseph's enjoying it very much.
Oh, would you? A girlfriend using your father to further her career?
Is that what she's doing?
Of course. Don't you just love the smell of naked ambition in the morning? Don't worry, you girls, when you complain about your lot, when it comes to climbing the ladder, you have everything going for you.
Can you just make sure that she gets these?
Yes. Yeah, sure.
I can't help but agree with Miss Naylor, but Ali is not my patient. Which leaves just one question, Joseph. Is an Oslo heart a chance that you're prepared to offer this young lady?
Put like that.
Yeah. Well, Mr. Jarvis, I think that your caller has been fought very successfully.
Thank you. I can't tell you how grateful I am. I'll go and break the news to Ali.
Good.
I just want to say that technically I know that this patient has nothing to do with me, but when Joseph told me about her, well, I just couldn't stop thinking about her. If I've overstepped the mark in any way...
Not at all. We're all in this together.
It's more a matter of whether we're now offering false hope.
Well, to a parent, is there such a thing?
Do you know, I think I'll get to the phone. Use a little influence to get that Oslo heart here more quickly.
You don't think this is maybe something you might have brought to me?
It was her dad that insisted on speaking with your
It's
father.
making me look a little foolish now, isn't it?
How?
Because I'd never even mentioned it to him. And now we're going ahead with it. It's as if either I was hiding it from him or I'm just not very good at my job.
No, it wasn't like that at all. I think your father was very proud that you were able to take on the arguments and come to a decision then and there. I was very proud of you.
Welcome, luck. A former colleague of mine, Anton Mayer, has pulled a few strings, and he's arranged for an Oslo heart to be dispatched to us straight away.
So when will you be operating?
As soon as it arrives.
Tonight?
I would think so.
Isn't that great?
Yeah.
It's dark now, so we'll still get to see the stars.
In the meantime, you rest as much as you can.
She will, don't worry.
Joseph, have you got a team standing by?
Yes, yes.
And who will lead the procedure?
I was going to ring Mr. Hope. I'm sure he'd want to come in for this.
Don't bother. I'll do it.
You?
It's not a problem, is it?
No, no. It would be an honor.
And I think, since Miss Naylor was the one to set us on this course, she should be part of the team.
Well, that's fantastic. Just to watch you work, I know will be enlightening. Would you care to have something to eat while we wait?
Oh, that'd be nice, yes. We need to keep up our strength.
Good. There's a restaurant I know 10 minutes away.
Perfect. Joseph, are you coming?
Yes, I'd love to, but I need to stay here and prepare.
As you wish. Shall we?
What's all that about?
I'm sorry?
She's all over your old man like a rash.
She came up with a very good alternative procedure. I should have seen it myself.
She's in GS. She shouldn't even be up here.
Well, it's all for the benefit of the patient.
Benefit of her career, more like.
Rather you didn't say things like that.
Why not? Because they're true?
Jack's motive is to help Ali. Look what she was like with that Bruno character. A lot of people read her wrong.
Well, just look at her with your dad. I'm not reading that wrong.
I'm not listening to you. You're just being vindictive.
Everybody's talking about it.
Really? In between talking about you and Maddie Young. Just stay out of things that don't concern you. All right?
All right.
They found me.
I'll just take a look at this.
Do you want me to come with you?
I'd rather have you help me with prepping the theatre.
Very well.
I wouldn't have minded going through that with your father.
Jack, about you and my father.
Yes?
So I'm not sure that you going out to have something to eat with him is entirely appropriate.
Is this to do with me suggesting using the Oslo heart?
No, it's got nothing to do with that. Well, that has something to do with it, of course, yes, but...
I knew it. Look, I've said I'm sorry, Joseph. I just got carried away with the idea. That's the sort of person I am, you know that.
Yes.
So let's just forget it, shall we, and move on? His throat will be...
Light years away.
What's happening?
They wanted a couple of minutes by themselves.
We need to get to the theatre, Lord Burns waiting.
Well, I don't think a couple of minutes will make much difference.
Jack, have you got a minute? About your relationship with his father.
And what do you know about it?
I've watched him.
Well, why don't you watch someone else? Because this has got nothing to do with you.
What happened in Dubai, I've kept to myself, as promised. This would be a big favour that you could do me.
Are you saying you may tell Lord Byrne about what happened in Dubai?
No. But Joseph might. You know, at a weak moment, he might let it slip. But if he felt that you and him were a team, then...
We should call them
I
back.
have to get her into theatre.
I'll go first, see if she's okay. She was a bit emotional.
Joseph, I want to apologise.
What for?
My behaviour today.
I'm not sure I know what you mean.
Yes, you do. I just got carried away with the idea of saving this girl, and I didn't think about what it must have looked like. Forgive me.
Of course.
No, help!
Well, you don't mean it.
Are you the theatre nurse?
No, I'm Mohammed's personal nurse.
Really? That's a new one.
Well, his father had me assigned to him.
So you're in the operation, then?
Well, he'll need me to interpret, and also Mr. Ahmed Al-Hashmi insists.
I get the feeling that whatever Mr. Ahmed Al-Hashmi insists on, he gets.
And you're
Jack Naylor, General Surgeon, Joseph Byrne, CT Surgeon.
Lord Byrne. Just imagined that you'd be older.
No, he's my father.
Right.
He can't make it.
So you're doing the procedure.
That's right. Suction. Suction.
Detacheft.
Can you see the tumour?
Yeah. It's stuck right up on the left upper quadrant on the hemidiaphragm. I think you should take a look.
Something wrong?
No, it's fine. Mr. Byrne, could we?
Yes.
Yes, I see. Seen this?
Can I help?
No, thank you. We're just working out how best to proceed.
So what should I tell the family? Mr. Al-Hashmi wants to be kept informed.
You can say that we've discovered further complications, but it's all under control.
How come Lord Byrne isn't here?
He's got a virus.
So you came instead?
No, we didn't know about the virus until we got here.
So you came
We came as part of the team. Got a bleed.
Okay, we may have a tear in the diaphragm.
The mesentery's falling
Okay, we have to
apart.
control the bleeding. Suture, please.
Heat.
Sorry, the other way.
Relax.
الضغط بينزل 90 على 70.
He's falling 90 over 70.
Right, okay, we'll need another 6 units cross-matched. This is not good.
Something wrong?
Okay, we have to control the bleeding. Could we get packs in the area, please?
Then what?
We...
Joseph.
Is there a problem?
Yes, the problem is the problem.
The problem is the tumour is bigger than we were led to believe. The scans we were shown back in England were old ones. Check the date.
So what happens?
I don't know.
What?
Joseph, we need to make a decision. What would your father do?
Okay. We get him into ICU, continue to transfuse him, we correct the hypothermia and the coagulopathy, which will give us time to reassess. Okay, so that's what we better do. We should have just walked away.
Easier said than done.
This is madness.
Is Mohammed going to live?
No.
Yes. Everything's under control.
Who is the boy's doctor? We need to talk to him.
Well, it was a Dr. Al-Kindi.
What do you mean, was?
When Mohammed's condition got worse, Ahmed blamed Al-Kindi's incompetence.
He has cancer.
Yeah, well, you know that, and I know that. But that wasn't good enough for Ahmed, so he dealt with him.
How?
I don't know. I mean, he certainly doesn't practice in Dubai anymore. He seems to have disappeared. You can do this, can't you?
Yes, of course.
Okay, if Al-Kindi went, then who's been keeping an eye on Mohammed?
Me.
Well, this is ridiculous. There must be someone else.
Not that Ahmed will allow near his son. He blames Arab doctors for the fact that his wife gave birth to 4 sons and only one lived. Mohammed.
We need to speak to a consultant that is familiar...
Just drop it, Josie.
Not that easy, is it?
Can you tell me what's going on here?
Nothing. Nothing. Everything's fine. We should get some sightseeing in while we can.
What?
Why not?
This isn't exactly the time for playing tourists.
Well, I don't see why not. We're here, aren't we? Anyway, you can suggest?
Sorry.
Sightseeing.
Yes, there's a couple of places.
If it was just a tumour, then we might have been in with a chance, but now it's attached itself to the lower lobe of the lung. My father would be hard-pressed to pull this off.
If he's stable, then his only chance of a long-term survival is an en-bloc resection.
But you're not getting this, are you? We're registrars. This procedure is like Mount Everest, even for the most experienced consultant, never mind us.
And if we don't do it? Look, I heard of a case where they didn't do an en-bloc resection and the cancer was back within 3 months. The patient was dead within 4.
Then we get someone else in. They can fly someone in from England, from the States. It's not like they're short of cash.
No, there isn't the time, Joseph. He won't last that long. If we don't operate tomorrow, then it's au revoir, Mohammed. Hi. We're gonna head back to the hotel and chill out a bit. Okay.
So perhaps you'd like to join us for dinner?
I'll check with my husband and get back to you.
Holby City Hospital is where you work, isn't it?
Yes, that's right.
Do you want to tell me something useful?
I'm reporting you. I knew there was something wrong in theatre. I should have said something then. You're registrars. Both of you, not consultants. Have you even done this operation before?
I've assisted. I've never been the lead surgeon.
And you?
I've done the operation once.
I don't believe this.
How did you find out?
I made a few calls. Wasn't very hard.
We should just disappear.
Fine. Let's just roll over and let the kid die. Then Al-Hashmi can dish out whatever punishment his millions can afford. And if we survive that, we can get a job cleaning the loos. Because that will be the only career left open to us.
This is incredible.
Haven't you figured it out? We're his only hope. There is nothing else after us. If you want to report us, go ahead. But you'll be signing his death warrant. You have a choice. You can give Mohammed some chance. Or no chance.
That's no choice.
So we do the operation. Good. And you don't tell anybody.
Okay. But somebody's bound to find out. I did easily enough. What about your father? Isn't he going to want to know what's going on?
He can't know. If Ahmed finds out I have no career, if my father finds out, I will lose everything. We should never have done
Joseph,
this.
change the bloody record. What we should do is ring your father before he rings the hospital. If he finds out
I
what's
can't do
going
it.
on- Fine. I'll do it.
No! He will know that there's something wrong if you ring him.
This has nothing to do with me.
You can say you're a representative from the hospital, that Mohammed's your patient. And like I say, if we don't do the op, who will?
But we...
Just spoke to your mother. She seemed to believe me.
You've obviously had practice at lying.
James. James, this is my husband. James, this is Joseph and Jack.
Nice to meet you. Well, you have to excuse me. I've got to go to the boys' room. Traffic here is murder.
I'm going to have a quick dip. Cool down. You coming in?
No. You just like playing with us, or...?
I'm trying to quit. James thinks I've stopped.
Have you said anything to him about us?
Everything.
Is he going to say anything?
No. He won't say anything. Hello? Hello? Natalie just called you.
Natalie?
I presume it was Natalie Kramer. I Saw you with her this afternoon.
Oh, yeah, that Natalie, yes. I just told her I was leaving.
When she heard my voice, she hung up.
She probably thought it was a wrong number.
What was she calling you about?
I don't know, she hung up.
Anything you need, or you're not sure of, just ask, okay?
Right, good morning, everybody. We've decided that our young patient is stable enough for us to continue. So if anybody would like to report that back to Mr. Al-Hashmi before we begin, you know where to find him. Well, let's make a start, shall we? Miss Naylor, would you please inform me as to what you intend to do?
What?
Please.
I'm going to make a thoraco-abdominal incision.
Very good.
I was sent by Mr. Al-Hashmi to collect the tumour.
Sorry?
It's common out here for the family to want to see the bits that are removed.
Very good.
Natalie, can I help?
Out the small bowel mesentery and free it from the abdominal cavity.
There's some attached to the lower lobe of the lung.
Yes, that's right. I need to staple across the lung in order to get a clear resection margin. We'll be removing the tumour en bloc. Miss Naylor will be taking it from the gut. I'll take it from the lung.
That would make sense.
Thank you. We'll need a kidney dish, please.
I'll take it in the jar.
It really should go to histology.
Well, not here. If they ask to see the tumour, they normally just send the margins of the resection to histology.
When in Rome.
Natalie, is there something going on that I should know about? Please, Natalie, I'm not stupid.
James asked me not to tell you.
Asked you not to tell me what?
He wants me to come in on your project. The care home.
Why?
He said you've a problem raising the money.
We have the money. We've bought the property.
Well, not according to James. He wanted me to go back with him next week and look it over. Sorry, Faye, but I'm not interested.
Okay. He's arrested.
Okay, I'm gonna massage the heart. Stand clear, please.
Still nothing.
It's not working.
Shows if we're losing him.
Okay, paddles, please. And we'll charge to 20.
Ready?
And clear. And charge to 20 again, please. And clear.
Blood gas results show his potassium levels are very low.
Charge to 20, please. Clear. Okay, we need 200 milligrams of amiodarone, 10 millimoles of potassium, please. Quickly. All right, and charge to 20 again.
Ready?
Clear.
Sinus rhythm back.
Okay, everything's fine. Okay, let's ventilate the lung, please.
The lung's not inflating.
Okay, what's happening?
I don't know.
I must have stapled the main bronchus.
You're miles away from it.
Okay, but the lung is not inflating. When you did this operation before, did this happen?
No.
What have we done different?
I don't know.
Come on, Jack, think. This is new ground for me. Pitching in the dark here.
So am I.
What?
I've never done the operation before.
Did you
I know what I said, but I lied.
This is it. This is it.
Are you sure that everyone has understood what you're doing?
I would have thought it was pretty obvious.
The clamp. Has the anaesthetist taken off the left-sided clamp?
Shelton Mashback?
Oh, I'm sorry.
Congratulate and thank you.
He's not out of the woods yet. We need to keep a close eye on him.
Yeah, I know he'll make a full recovery. I'll be ringing your father, telling him how well you did.
Ringing him?
He must be very proud of his son.
I'd rather you didn't do that.
Why not?
Your son is alive due to a lot of luck.
I think it's the will of Allah.
Our problem is if this gets back to the GMC in England, it won't look good. It could go on our records, and, well, who knows what they might do. You see, it's our responsibility to be honest. And we won't.
We'll get in trouble for saving a life.
For breaking the rules.
Then anything you want while you're here in Dubai, just ask, it's yours.
Thank you.
What about your payment?
Oh, really? I don't think we
can't remember what was agreed.
10,000 sterling.
Very generous.
Except, of course, we did 2 operations in the end. So I think we need to renegotiate.
You saved my son. 20,000 sterling.
I think that's very fair.
Are you mad?
A deal's a deal.
He won't bat an eyelid. He'd have paid you anything.
Shall I go back in?
I'm talking about the fact that you've never done that procedure before.
It didn't seem to matter in the end.
That's not the point. You lied to me.
And if I hadn't, what would have happened? How would your career have gone with a hand missing?
So I just wish you'd have told me, that's all.
No, you don't. If I'd have told you, you couldn't have hacked it. Which is why we make a perfect couple. You need me.
You know, I think Ahmed was right. It was the will of Allah.
I tell you, that had nothing to do with Allah.
Jack, it's me again. You never got back to me last night, and I've been trying even more. I'm just slightly...
Says, give it to me, baby. Just one more time.
Heather, I'm going to put some pads on your chest so I can monitor your heartbeat, okay?
I want to see Anne.
I'll see what I can do. It's been a huge RTA, apparently.
Yeah, you think you'd be more useful back on the ward?
I'm going to contact the patient's husband. Joseph.
What?
The solicitor you recommended, he's been very helpful.
Yes, I'm sure he'll sort everything out for you.
I hope so.
We're needed in AAU. You all right?
I can be better, thank you.
Where have you been? We're expecting up to 30 people through ED.
Well, where's Lola?
Week's leave, more's the pity.
Good luck.
Where are you going?
Oh, on my break.
No, there's no time. We're going to have to set up a triage by the clinical room, please, and page Matt and Dean.
We'll be lucky.
Why?
Well, Dean's been shipped off to psych, and Matt has been suspended.
Why? Turns out he was having it off with some patient.
Well, I'm going to take you down to X-ray now, and then somebody will check out your head injury.
My friend, Heather, I don't know what her married name is. How can I find her?
Oh, it's probably best to talk to reception. I'll see contact with it.
I haven't had a chance to say hello and everything. We hit something.
I don't know the details, sorry.
You're going to have to get some more nurses because I'm not killing myself.
All right, don't worry, I'm onto it.
How many vehicles were involved?
I think 4 cars and coach, as far as I know.
All right, well, look, I've managed to get another doctor allocated to you here.
Good.
She's on her way down now.
Oh, that bed, please. Hello. Sandy, how are you feeling?
Like someone's gone and kicked me in the belly.
We'll get somebody to come and check you over properly and then get you over to X-ray as soon as possible.
Last time I saw her, she just had her stomach pumped after downing a bottle of sweet cider.
What?
Oh, don't worry, darling. I'm talking 20 years ago. Class of 1986. We were on our way to a school reunion. I mean, it was hard enough recognising people before. Now half of them have got their limbs hanging off.
Excuse me.
Well, you seem to have everything under control.
I'm doing my best. No, don't leave her there. Take her to the clinical room, please. Thank you.
Actually, it couldn't have come at a more opportune moment. Only yesterday I had an email reminding me that your locum consultant contract is up for renewal.
So I'm being tested. Is that what you're saying?
It doesn't hurt to be outside your comfort zone once in a while. No, if you'll excuse me, I'm needed in ED.
Hello, I could really do with some help here.
Diane, sorry, I forgot to say, you remember Tandy, don't you?
Yes, of course. How are you settling in?
Everyone's made me feel very welcome.
Good.
I have no doubt that Diane will prove to be an excellent mentor.
Right, well, you can start by helping Nurse Jackson with the triage, please.
Okay.
Okay. Security!
Okay, Heather. I've spoken to your husband and he's on his way. In the meantime, we're going to take you downstairs for a scan. Heather. Heather. She's arrested. Can you back her?
Yeah.
You're right. I'm fine. She's breathing. And ticking.
Do you reckon we should have stopped at the third bottle?
Why'd I even let you talk me into the night out?
Because you thought you had the whole day off, and anyway, there wasn't much force involved.
Fancy a bet?
On what?
And how long it takes before Diane flips?
Where am I needed, please?
I don't know. I have to ask Diane.
Who's ruffled his feathers?
How should I know?
Could you take a look at Sandy Booth, please?
I thought Diane was in charge.
That's right, and that's why she put me on triage.
Nobody will take...
I can assure you I am fully qualified.
It's just I've got a thing about women doctors. Oh, you don't mind taking a look at me, do you, Doc?
It's not entirely orthodox.
I'd really appreciate it. No offence, darling.
None taken.
Just take a quick look at your x-rays whilst Nurse Jackson takes your blood pressure.
I was dealing with it.
Not very well, it seems.
Is this because I went out with Sam last night?
You can come and go as you please.
We had a difficult shift. We needed a blowout.
I've been calling you all day.
My phone ran out of battery.
I take it you're feeling a little worse for wear.
Well, I wouldn't be here at all if it wasn't for this RCA.
Well, then it's just as well. You wouldn't have been in any fit state to join my parents.
Your parents?
That's right, they'd invited you for lunch today. That's why I was calling. Don't worry, I'll be sure to let them know why you couldn't make it.
Self-prescribing, are we?
Well, at least now I know why Joseph is being off with me.
I take it he didn't approve of last night.
Oh, set him right, Sam, please.
There, let him screw him a bit.
No, I don't want this getting out of hand.
Don't worry. I'll tell him we topped and tailed all night.
You've an open book fracture to your pec.
About last night.
It may have escaped your notice, but I'm rather busy.
Nothing happened. I mean, she tried, but I was way too drunk to do anything about it. Joseph, lighten up.
Why should I even be surprised? I mean, everyone in the hospital is aware of your reputation.
What can I do?
What about Jackie? You hoping to add another notch to your post?
I'm game if she is.
Excuse me?
Joe.
Oh, he didn't seem convinced.
Well, I tried.
Well, not hard enough by the looks of it. And what do I do now?
Look elsewhere.
Got back on the piece then. So, right, I'll just get a doctor